Welcome to the Ageless Pet Podcast, where we help you achieve optimal health, reverse disease, and extend health span in your pets. This is your host, Dr. Carmen Bausoni.
And Dr. Gabby Varco.
We are today going to be talking about pain, a very, very common problem that we have in all of our pets. And September is Animal Pain Awareness Month, so we figure we're going to drop 2 episodes, this one and the next one, on pain on our pets. So that's what our goal is here. So pain, I think we all know what pain is to some level, but it is a complex issue, and everyone obviously has experienced it. So the definition of pain, which is a little, academic, but by the International Association of the Study of Pain, is an unpleasant sensory emotional experience associated with actual or potential tissue damage or described in terms of such damage.
It's a mouthful.
So that's the definition of pain. It's like one of those things that when you read it, it's one thing, but when you feel it, you know it.
Yeah. And then there's a lot of ways that we classify pain. I think the easiest one that when everybody thinks about is acute and chronic pain.
Right. I'm going to interrupt you.
Yeah.
And I'm going to say that I don't know if everyone knows this, but Dr. Varco is a certified veterinary pain practitioner. So I'm going to toot her horn because she won't do it by herself.
That's really nice.
Now that I'm done mansplaining, go ahead.
So acute pain serves a purpose. It's protective. It has a warning function. It's when you touch the hot stove and you pull away because it hurts. You just protected yourself from a burn. And this type of pain tends to respond to pain medication. Then you have chronic pain where there's no direct relationship to noxious stimuli. So there's no protection. There's no warning function. And that one is a lot more challenging to treat with medications, right? So maladaptive pain also has no such benefit, and it's considered pathologic. And when you think of things like nerve pain and windup, that's maladaptive. So anybody who's over 40 who's felt their sciatic nerve, there's some nerve pain there.
Exactly. I mean, if you think about acute pain, like she said, with putting your hand on the stove is one thing, but even you twist your ankle, right? Your ankle swells, that hurts, and there's a reason why you're limping or staying off of it. That's protecting, right? We're protecting ourselves from that pain, but that should get better in the next 3, 4, 5, 7 days. It shouldn't be taking 7 months to get better. If we're hitting that 7-month point, then we're in maladaptive pain, right?
Oh yeah.
So just think about those things. And the chronic pain, obviously we always think about like arthritis, right?
Yeah.
That's a chronic pain, and that's pretty obvious. And then this maladaptive pain, I'm sure we all have had experiences where we know somebody who, with the lightest little bit of touch, is extremely painful. That's you're on fire, your nerves are on fire. That type of pain is not appropriate, and I shouldn't touch you on your shoulder and you scream in pain from a light touch. That's allodynia. That's maladaptive neuropathic pain. So,
and we know that you get chronic pain syndrome, right? Like it actually, like you get pain memory. Your body remembers this. Right. And when we have this maladaptive pain, we really want to reach for pharmaceuticals. This is the time that we really need to look for medications like pregabalin, gabapentin, amantadine, et cetera, to treat that pain initially. And you can always incorporate rehab modalities and integrative medicine and supplements and herbs, but that's going to take longer to take effect. So we want to get you out of this pain cycle, doing that with medications while the other things take effect. Right.
It's not that acupuncture isn't going to help, but sometimes, that tiny little needle may not hit the achieved goal as you want. Sometimes you need the hammer, and the hammer might be an NSAID or gabapentin or something like that. So, and by the way, nothing's wrong with using all these things together as a integrative approach. That's kind of what we do.
Yeah, multimodal
integrative approach. So using what you can to achieve that success. I was listening to a podcast the other day on humans, and one of the things they were talking about was the emotional component of pain, and we're going to go over that as well. But it's interesting because most of the research is focused on the pain receptors or nerve fibers, opioid receptors, blah, 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 blah. But, and of course now it's cannabinoid receptors, et cetera. But the emotional component of pain is a big deal, right?
Yeah.
I mean, I have back pain all the time. It's better and worse. Some days is great, and some people say, "Well, you should get an X-ray." I'm like, I don't want an X-ray because, or an MRI, because then I'm going to be focused on that pain all the time. I'm like, oh, I got compressed discs and I got arthritis. I have to watch out for my back, and I don't want my brain to be in that spot. I want to be like, yeah, back hurts, getting better, it's fine.
Positive.
So
yeah.
But yeah, reaching for those drugs are really important when we really need it, and reaching for them earlier before we get to that wind up pain or maladaptive pain.
Yeah, it's like we're chasing pain. Once you have that level of pain, it's so hard to get under control.
Yeah, and we see that all the time. So there are some, physiologic signs of pain. So we're just going to hit that real quick. So both physiological and behavioral signs of pain in just about every species that we see. It's stimulation of the sympathoadrenal system. You'll see increased heart rate and increased blood pressure. I think we all feel that when we have increased, what do you want to say, acute pain, your blood pressure and your heart rate will definitely go up when you get hurt. Decreased peripheral blood flow. That's always an interesting one because, you hurt your knee, you would think more blood flow would go there, and it does. But then after that, your body's kind of shutting off that pain and decreasing the peripheral blood flow. Decreased GI motility, decreased urinary output, those kind of things. I think really importantly, though, that we don't think about, and I focus on this on a daily aspect, is the suppression of the immune system.
Yeah.
Pain in general will suppress your immune system. And if you're in chronic pain, you're going to get sick more. You're going to be more susceptible to disease in general. Impaired wound healing, that's a huge one, right?
Yeah.
Back in the old days, remember that, we've been used to talk about, we don't want to give animals pain medication after surgery because then they're going to be too active and they're going to hurt themselves. I still hear that occasionally, which blows my freaking noodle. But obviously, if they just had a surgery and they're in pain and we don't give them pain meds, what's going to happen?
They're not going to get better.
They're not going to get better. They're not
At
going to
least
heal.
Eventually they will. But yeah, they're going to suffer.
Yeah, it's just.
And we took an oath.
Right. Yeah, we did. But it's funny how pain has changed, and I've heard that they used to think about that with pediatrics and children. That kids used to not feel pain; they didn't want to give pain medications to kids, and we see so many effects of pain, like we said, wound healing, disease, immune system, etc. So, just think about those things, and pain is a memory. So you will get pain syndrome, like we just talked about. So those are some of the biggies.
Yeah. And, in the human field, they've done some imaging techniques that have allowed us to understand that pain results from activation of a number of brain regions, such as the amygdala, the insula, and the anterior cingulate cortex.
Yeah, and then we're learning that pain is a really complex interaction between the immune system and the nervous system and the endocrine system. So it's funny, that in the holistic world, we know that everything's related, right? It's like, it's not just a liver in your body. Your liver is going to affect your immune system. Your kidney is going to affect your heart, et cetera. Especially in traditional Chinese medicine, we know that there are organs that are related. But I think in Western medicine, we really haven't put everything together. But if you're looking at these things are nervous system, immune system, endocrine system, all affected by pain. Yeah. So it's kind of a big deal. And managing pain is really important for your pet's well-being and quality of life. So we have to get that pain under control so your pet can live its best life. And pain can stem from various sources, of course, including injury, surgery, arthritis, dental issues, chronic conditions, like I said, arthritis, etc., back pain. We see lots of ligaments and muscle pain in what we do as well. So I think we all focus on, the hip problem. But how many times do you have a dog that comes in for quote unquote hip dysplasia and it's a low back problem?
Oh, yeah. Yeah.
Or an iliopsoas problem.
Oh, that pesky iliopsoas.
Our favorite.
Oh.
So, yeah.
So this kind of leads me into, how do we recognize pain in pets? Pets can't really tell us they're in pain, so it's really important to watch for behavioral and physical signs. And there's some common indicators of pain in pets. So the big one we see is a change in behavior.
Right.
So if you have a dog that's normally passive, they might become aggressive when they're in pain, or they might display unusual antisocial behaviors like hiding or even avoiding eye contact with you.
Right. People always talk about my dogs or my cat. My cat, you see all
Mm-hmm.
the time hiding under the bed, right?
Yeah.
So we'll see that all the time too.
Yeah. Decreased activity. That one's a little bit
Mm-hmm.
easier too. So they don't want to play. They're not going up and down stairs. They are reluctant to jump, or they're just having trouble standing still. They're kind of
Mm-hmm.
moving around, they're restless. And this one can get a little bit
Mm-hmm.
more challenging as your pets age, because then
Right.
people say, well, they're getting older, or they're not going to do as much. But here it's because they're uncomfortable, they're in pain.
Right. But we do see that though, right? In the exam room and stuff, a dog, if you watch them closely,
Yeah.
even when they're standing, sometimes they'll be shifting their weight. Sometimes they
Mm-hmm.
even look like they're dancing on their front legs or their
Yeah.
back legs, or they're off-putting weight or something. And that's really interesting.
Yeah, and that goes with altered posture, right? So that's what you're
Mm-hmm.
describing.
Right.
It's changes from their normal posture. So they might be hunched, they might be trembling, they might be more stiff, they might not want to move or shift their body weight around to a different limb, or if they have multiple limbs that hurt because it's not always just
Right.
one,
Yeah.
then they're kind of doing that little dancing like, oh, I don't want to put my weight on that one or that one, and they shift
Right.
around.
Yeah. Or the classic one too we see is a dog in that kyphotic posture,
Oh, yeah.
right? Or the
Mm-hmm.
Halloween cat posture, not to
Mm-hmm.
that extreme, but the big curve in the back. We see a
Mm-hmm.
lot in the little dogs. We see that a
Oh,
lot
yeah.
in, right? But those dogs are, you see that curve in this, and it's, to me, there's very few things that cause that except for back pain.
Yeah.
But something in the back, whether it's arthritis, disc, muscles, whatever.
Mm-hmm.
But I think we all get so used to seeing it, we don't even pay attention
Yeah,
anymore.
and sometimes abdominal pain too. They'll kind
Oh
of be a
God,
little
yeah.
arch like that. They're
True,
just
true.
guarding their
I didn't
abdomen.
think about that. It's true.
But yeah, any change in posture
Right.
is going to do that. And then this one's not very specific, but panting, when they're in pain, sometimes they will pant excessively. So they're just breathing a lot faster, a lot more shallow.
Right.
And it can be accompanied by trembling. It can happen at odd times, like in the middle of the night when it's not really hot out.
Right.
So that could be an indication of pain as well.
And we see that all the time, right? People come
Mm-hmm.
in and they're like, my dog's panting a lot. What does that mean? Well, it could mean anything from pain,
Mm-hmm.
Cushing's disease,
Mm-hmm.
senility, dementia,
anxiety,
heats,
Yeah.
obviously it could be lung disease,
Yeah.
but it is definitely one of the signs we look for pain.
Yeah. And then this one is not common, but I'll mention it because everybody thinks this: vocalization. So
right.
your pet may become a little bit more vocal when they're in pain, or they might make random noises like whining or barking.
Mm-hmm. Yeah, this is one of the things that gets me a lot when people come in and they say, well, their dog is standing there not using one of its legs.
Yeah.
Well, but my dog's not in pain.
Mm-hmm.
Well, why isn't he using his leg?
Right.
I think that leg probably hurts. That's why he's not using it. But what are we thinking? We're thinking that he's not crying, right? He's not grumbling or whatever. But
Yeah.
or another one you're going to talk about later is appetite. But
Oh, yeah.
But I think recognizing pain in dogs is really important. Just because they're not screaming or they're still eating doesn't mean they're not in pain.
Right. So changes in appetite, it could be decreased or increased eating or drinking. And I will watch dogs with broken teeth still eat. I will watch, I've seen dogs with a broken limb still walk on that leg.
Oh.
So, people, when we're looking in the mouth, and that's always really challenging, and to figure out, like, unless it's an obvious fracture, because sometimes you have to do the dental radiographs or dental x-rays to really see something there.
Definitely.
But the dog will keep eating. And I had a broken tooth that was misdiagnosed, and I still had to eat.
Yep.
And I tell you, that level of pain was unreal. And I had it for like almost a month. And if a dog had that pain, or a cat, they're still going to eat. They're still going to do all the things. So yeah, like you keep going. You have to.
Yeah, I don't know. I think someone told me one time that like eating is a very well controlled evolutionary tactic.
Yeah.
I mean, that's the lowest thing on the totem pole that you're going to lose when you're in
Yeah.
pain. You're going to eat. You know, you have to
Mm-hmm.
eat to survive. So we've all seen dogs whose mouths look like what we call trench mouths. I mean,
Mm.
they breathe on you and you feel like you just got sick. You know, they're
Yeah.
just disgusting. And I don't know how these people stand their dogs when they have that breath, but anyways, though, and we've seen abscessed teeth, right? And the
Mm-hmm.
dogs are still eating with
Mm-hmm.
abscessed teeth, or the cats
Mm-hmm.
are still eating with abscessed teeth. You know, so um, please don't use appetite as a
Yeah.
signal for pain.
Yeah. And then we talked about it limping. And
Hmm.
that's often the first sign that something might be wrong, especially if it lasts more than a few
Right.
hours.
Exactly.
Grooming issues. So, licking an area that hurts can be comforting for dogs. And this can be it's true, especially for older dogs with arthritic joints. And sometimes cats will overgroom areas as well. And changes in elimination habits. So, difficulty going to the bathroom, urinating,
Yeah.
defecating.
Yeah. I mean, the grooming issues. I saw a dog just the other day that the owner came and thought it was having allergies because it was licking its hind feet.
Mm-hmm.
Well, and that could be, obviously, that's
Right.
definitely one of the things to see. But the hind feet aren't exactly the easiest part on the body to reach. I mean, your front feet are a lot easier if
Yeah.
if you're anxious, you have allergies. And when I did examine that dog, boy, that dog had some lumbosacral pain. It
Oh,
was
yeah.
really painful in the LS joint. And we took x-rays and it had horrible LS disease. And
Mm.
I strongly suspect that he's licking those back feet as a self-soothing
Yeah.
kind of thing to help him out.
Yeah, that's called the gate theory.
Oh,
Yeah. So Melzack and Wall in 1965 came up with a theory that explained how a non-painful stimulus can reach the brain faster than a painful one. So this is
mm-hmm.
why when an area hurts, you rub it, the pain
Right,
improves.
right, right.
And that's why the dog will lick, especially for referred pain, right? So that dog had lumbosacral disease
Mm-hmm.
but was licking the feet. That
Right,
that pain goes all the way down. It just
right.
radiates.
And we don't know, did that dog have sciatica or something like that? I don't
Right.
know. I didn't pick that up, but it's definitely a possibility that some nerve
Yeah.
was involved with the sciatic pain. Yeah, the gait theory is interesting, right? Because you would think I just stubbed my toe. I'm not going to rub it.
Right.
Why would I do that? But you do, right? And it feels better.
It does. It
Yeah.
helps.
So the gait theory, 65, that was before I was born.
Was it?
Yeah, it was, believe it or not.
Okay.
So, yeah, so that's kind of a big deal. And assessing pain is interesting, and it has so much to do with genetics and experience, what you've
Mm-hmm.
experienced in your life and so forth. But yeah, I just had a pretty bad bursitis in my shoulder, and
Oh, yeah.
the doctors told me, "Wow, I treat high school football players and they're screaming in pain with this," and I was just like, "Well, they haven't lived enough to know what real pain is like." I think it's true. It's experience. I mean, it's
Yeah.
like they're like, "Oh my God, I'm hurting." I'm like, "Oh, come on, you get over it."
Mm.
But identifying pain in some animals, like dogs, may be easier than in some of our prey species, like
Mm-hmm.
in rabbits or rats or things like that, or even some of our birds.
Yeah.
So having a lot of experience with exotics, it is difficult. In these species, sometimes they're just a body position, because they're
Mm-hmm.
not really vocal. So sometimes they're just not moving around a lot. Sometimes they're sitting in, like, for rabbits, I call it the little meatloaf position. All their
Mm.
legs are tucked in under them and they're not
Yeah.
moving. Sometimes they're grinding
I
their
was just
teeth.
gonna say that grinding teeth.
Yep.
Yeah.
Rabbits will grind their teeth, so birds will just sleep a lot and they
Mm.
won't move, so there are a lot of, you just got to get used to seeing it. And a veterinary assessment is definitely very crucial
Yeah.
in identifying these pain things. So I think veterinarians in general will see a dog and will look at a dog, looks like it hurts a little bit,
Yeah.
and we can try to identify it. But there are a lot of tools that you can use, and this is kind of an exciting thing that's happened over, I don't know, what do you say, the last 10 years?
About at least. Yeah. There's been more and more, even more recently too.
Yeah, so it's just really cool. So there are pain scoring systems, that there's so many of them that are numerical scoring systems, or visual analog systems, or simple descriptive systems. One of my favorite, and it's not the only one, don't get me wrong, but I think the Colorado State University
Mm-hmm.
Veterinary School has developed pain scores in both their dogs and cat species, and horses too. So I think that's a very interesting one to use. So CSU, you can go to their website. We'll go ahead and post some
Mm-hmm.
show notes on there as well. But I think for our purposes, they have some for cats and for dogs, and it'll go from everything from, subtle signs of pain, like they may be less interested in their surroundings, and it'll go up to, decreased responsiveness, quiets, sitting there in a curled position, et
Mm-hmm.
cetera, et cetera. But I think going to the CSU website is a great idea
Yeah.
if you suspect or you're thinking that is my dog in pain. If you just type in, CSU pain charts, you'll be able to find it, and they're
Yeah.
downloadable. You can print them out. Most
Mm-hmm.
veterinarians have them.
Yeah. And they have an acute and a chronic.
Yeah, that's right. The acute and the chronic. I think a lot of people forget. Veterinarians may forget about the chronic because we're so used to looking at acute pain scores, but
Mm-hmm.
it's really important. And there's so many different ones. Like I said, I mean, there's just numerous pain scores, but that's how important it is that we have so much of it. And pain is often overlooked in cats, right?
Mm-hmm.
And so I think that's an important thing to look at. And like I said, the CSU one is a good score, and they have a whole bunch of ones, but there's this really cool one that Dr. Varco is going to cover here.
Yeah, so grimace scales were developed for a variety of
So
animals,
cool.
including mice and rats, rabbits, horses, some farm animals. And the feline grimace scale is one that objectively measures pain based on the facial expression and behavior of cats, which is really
So
cool.
cool.
It looks at 5 action units of cats to identify pain. So it looks at ear position, orbital tightening, meaning the eyes, muzzle tension, whiskers position, and head position. And there is a variety of studies that have come out, on the feline grimace scale. This one study from 2019 looked at facial expression in 50 adult client owned painful cats and then 20 control cats that were not painful. And this scale contains 6 questions regarding the overall cat's appearance, their response to interaction, and then palpation of a potentially painful area. And they used video recordings, and they would go in, and once they identified the cat was in pain, if a cat scored 4 or more out of 16, they were considered painful.
Right.
Those cats were given pain medication, and then an hour later, they went back and recorded again. So basically, this specific study concluded that the feline grimace scale is a valid and reliable tool for acute pain assessment in cats.
Right, yeah.
And what we really like about this is that there's a free app available, and we often recommend that our clients with cats download the app because it's really user-friendly. It's got pictures. It's really fun. Again, it's free, and it's called the Feline Grimace Cat Scale.
Mm-hmm.
It's like a little yellow app with a cat face on it.
Mm-hmm.
And you can go through and look at your cat, assess it. There's a spot where you could take a picture, and then it'll score. So it's a good way for people to keep track of if they think their cat's in pain or not.
Right. Yeah. And I love the fact that you can take a picture of your own cat, and obviously the scale is really important too. So I really love this app and recommend it to my feline. So that's a great scale. So managing pain in pets, that's a huge topic, and I think we'll get into more on our next episode, but I think we want to touch on it a little bit because unmanaged pain is a huge stressor to your physiological system, and as we already discussed, can negatively affect almost every aspect of your body, including the immune system, the endocrine system, the cardiovascular, the digestive system. So it's
everything.
Yeah, just pretty much your whole body. So we all know people who've been in chronic pain who are just a mess from many different anatomical systems. So, but management of pain is super important. So, for example, everyone knows about medications, right? So that's kind of our first line, right? So NSAIDs are nonsteroidal anti-inflammatories, steroids. That's a whole other one. Opioids, which we're all familiar with. MDMA antagonists like ketamine and amantadine.
Mm-hmm.
There's some tricyclic antidepressants that are helpful. And then this amazing drug called gabapentin, which is an anticonvulsant, but how does it work? I don't know.
Was that in air quotes?
Yeah, exactly. It was in air quotes.
And then there's obviously like other medications. In episode 2, our next one following up, we'll go into a little more detail, but intra-articular therapies or joint injections. And there's more and more things coming out, but a lot of dogs with osteoarthritis can benefit from, different devices that are out there and steroid with hyaluronic acid, platelet-rich plasma, stem cells. There's a lot that can be injected into the joint.
Yeah. We do a lot of joint injections, right, for pain management. I'd say they, in our hands, I think they work a lot, so joint injections are good, but they're a little bit more invasive, right, than your pain management stuff.
But there's no reason it can't be a first line of defense too, right?
I think one of my problems with joint injections is that I don't use them fast enough. I wait too long for that. So
I think we all kind of sometimes look around and say, okay, because it is more invasive and
more expensive.
And, the dog has to be under anesthesia.
More sedated, yeah.
And so sometimes it's, let's try these other things first. But, you and I both have done end stage joint disease where there's like, okay, we have to do this first.
Right.
So I think those are the obvious cases where you're going to be like, okay, the first thing we're going to do is do that. Right. And then we're going to incorporate these other things too.
Yeah. Yeah. So I think that's one of the definite things that we should be looking into more. And I think is being more and more used in veterinary science as well as in humans, right? The joint injections, supplements and diets, huge thing where supplements, I mean, oh my gosh, everything from fish oil to curcumin to boswellia to UC2 to
PEA has a couple studies. Agmatine.
So many different things out there. Some of them work, some of them maybe not so great, but I'm a big fan of a supplement called Traumeel. We use that a lot. Another one called Zeal. But there's so many things. There's even diets out there, formulated dog diets that are made for osteoarthritis pain. They have high doses of fish oil or glucosamine or chondroitin or other ingredients in there.
Or they're a weight loss diet, and that's how we're addressing pain, is getting the weight off.
Yep. That weight is, as we've talked about, obviously kind of a big deal.
So rehabilitation therapy is another big one, and that involves so many different things, because when we do rehab, we always have to manage pain first. Everybody wants to come in and my dog is weak and we want him to get strong, and I'm like, that's great, but we have to address the pain first. And we can do that with modalities such as laser therapy, shockwave therapy, pulsed electromagnetic field therapy. There's a lot of those kind of modalities, acupuncture, because we do that a lot with our rehab therapies. Manual therapy is part of our rehab, because a lot of these guys have trigger points. They have myalgia, which is muscle pain, and we have to get our hands on them. We can't just throw modalities and medications.
Right. I mean, you just can't build up strength if you're in pain. So we have to address that pain, and that's where all these different modalities come into. So rehabilitation and alternative therapies sort of blend into one another with acupuncture, shockwave, laser therapy, PEMF, etc.
Veterinary spinal manipulation therapy, also known as chiropractic. Yeah, all of that really just works really well together.
Yeah, so super important. And environmental adjustments, right? So, I mean, we may have to start putting yoga mats on the floor. We may have to, because our dogs are going to slip when they get older, so sometimes that's really important. There's so many different ones.
And, some dogs, people will say, oh, they won't walk on the tile floor anymore. Like they're afraid of the tile. And we have to rule out pain because they probably slipped and they hurt. And when they're walking on that low traction flooring, they're using so many muscles to keep from slipping. Like it just hurts and they just avoid it.
Yeah. Tile floors or these laminate floors that don't have a good gripping on them is hard. That's why sometimes we have these different devices we put on dogs' toes or on their pads that'll help them grip the floors a little better as well. So, but But yeah, addressing the environment is super, super important. I had a rabbit I just saw today, actually, and this rabbit had a neck problem months and months and months ago. And we treated him with chiropractic, a CC loop, CBD. I didn't mention CBD earlier, but CBD, etc. And the lady had she told me she had yoga mats all over her house for this rabbit. So, so it's really, really important for that kind of stuff. So
yeah, environmental modifications and support systems, supportive harnesses to help them get up and move around. And for those dogs that won't use like the dog stairs, because some dogs just don't like them. Some of them aren't stable. Some of them aren't used to stairs.
Right.
I'll have people get an ottoman and then put it in front of the couch or in front of the bed. So it's kind of like, okay, they have a bigger step, but it's like in between getting up and off of the taller furniture. And that's wider. It's more stable. It's sturdy.
Yep.
Ramps.
Yeah, ramps. See a lot of those.
Yeah.
There are so many different environmental modifications you need to make to keep your pet safe, as well as, to help them move around and whatnot. And then, preventing pain is a huge deal as well. So just reducing the risk of pain. So regular checkups with your veterinarian, right?
Yeah, catch things early.
Weight management.
Yeah.
Kind of talked about this a little bit, right?
Yeah.
So kind of, we've already talked about this, but again, the gold standard in pain management in overweight dogs is
weight loss.
I mean, nothing else will do better than that. Dental care. Yeah. So kind of a big deal.
And then we just talked about the whole safe environment.
Right. Comfortable living space. So we'll definitely hit more of this in the next episode. But I think what I wanted to do, or we wanted to do, I should say, today was really kind of help you recognize pain in your pet. And I think as veterinarians, we all see those, I hate to say it, but what we would look at as obviously painful pets that people will say they're just getting older.
Yeah.
I mean, Jesus, we've all seen I've done dentals on dogs where I've taken out, oh my God, unfortunately, like 20, 30 teeth, or I've taken out a broken tooth, or taken out an abscess tooth, and the owners come back and say, hey, I just thought they were getting older, but they're acting like they're 5 years younger.
Yeah.
I mean, we've all seen that before, and that's pain, and we didn't recognize that it's pain. And our goal as pet owners and pet practitioners is to let our dogs live the best life they can, and then we all feel horrible when something like this happens, when they're in pain and we didn't address it. So big deal. But we talked about this already, that dogs getting up, right? So we can look at a dog and in an exam room, I can see this dog kind of take a long time to get up, and you might think it's getting older, but I'm looking at it and I'm seeing this dog kind of shift his weight back and then slowly move his weight forward to his front legs, and just it's obvious that dog's back end somewhere, whether it's his hips or knees, his ankles, his low back, is hurting. And I think we just need to get better at recognizing, as owners, as pet parents, as veterinarians, at recognizing these signs of pain.
I'm going to do a little plug right now because we're talking about pain, and this is arthritis pain, but it's obviously one of the most common causes of pain. This video is phenomenally done.
Is it the Zoetis one?
No, it's canine arthritis management, and it's in silence.
Yes.
And it will make you cry. And it is so good.
I can't watch this one again.
It is so good. It's only a couple of minutes long. It is phenomenal. I've watched it so many times. I have so many people watch it.
I think this video has been played at veterinary conferences, and I've been in rooms of 200 people, and I really don't think there was a dry eye in the house.
I mean, you can't have a dry eye.
Cold-hearted veterinarians, right?
It's such a good video, so I really encourage you to just Google it or put it on YouTube. It's the Canine Arthritis Management in Silence, and it's it's from 2018, I think, a few years old, and it's just under 3 minutes.
Okay.
And it is phenomenal. Yeah. It is just such a great representation of what we do in
So
our
good.
profession and what these dogs are going through.
Yeah, it's one of those things that, you'll see it in the video, but we always talk about this, right? I wish our pets can talk.
Oh, yes.
And that's a classic example.
It
that
is.
video is, and it's
great.
So amazing. So definitely watch that one.
Yeah. Yeah, because they suffer in silence.
Yeah, exactly.
And we don't want them to.
Yeah, so that's our goal. It's identify pain. I think in our next episode, we're going to really hit on some of the multimodal approaches, what we just talked about, medication, intra-articular therapy, supplements, diet, rehab, alternative therapies, etc. So let's hit that. Our goal for today was for us to realize when our dog is in pain, when our cat is in pain, when our rabbit's in pain. Oh, I didn't mention that Dr. Varco mentioned the feline grimace scale. I work with a veterinarian who did a lot of laboratory work before she got into private practice again. And all these scales are available for rats and rabbits and mice because they need them in research. So, but they are available, and I've seen some of them that she's shown me that I wasn't aware of before because it's not my area of expertise, but really, really cool. So there's a lot of good news.
Yeah, there's a lot of good resources out there.
Yeah.
Well, thanks for listening.
Yeah, thanks.
We'll go over some management strategies next time.
Yeah, join us next time and we'll go over it. Let's do it.
All right. Thanks.
Thanks, guys.
Bye.